Senate Bill 730 by Senator Wolk, enact relating to railroads.
Senator Wolk.
Thank you, Mr. President. SB 730 will protect communities by requiring that the freight trains and light engines, carrying freight within California will be operated with a minimum crew size of 2 for public safety reasons and for the protection of railroad workers and our communities. California has over 6,000 miles of railroad track that crisscrosses the state, and today's freight trains carry extremely dangerous materials that pose significant health and safety risks to the communities and to the environment in case of an accident. Just yesterday in North Dakota, you read of the evacuation of a community. 6 out of the 100 cars caught fire. Luckily, no one was injured as far as I know as of this morning. 730 is not, by the way, a magic bullet. There are a lot of efforts going on at the federal level and here at the state level and at the local level. At the local level and the state level, we've been very active in terms of increasing the number of inspectors, focusing on local preparedness. There will be more action in the budget to strengthen that effort as well. And at the federal level, these issues, which often are preempted by the federal government, there has not been very much action in terms of doing away with these kinds of cars, as well as reducing the volatility, things that are able to be done and that haven't been done. We are not preempted from taking action with respect to crew size, so this bill will require that 2 be on freight trains. I ask for your aye vote.
Members, debate or discussion on this item. Senator Stone.
Thank you, Mr. President. I respectfully rise in opposition to SB 730. As you know, with the many incidents that we've had, especially in commuter trains, we have now positive train controls. And the operators of these trains, they're carrying, billion-dollar payloads. They certainly are going to ensure that they have the appropriate staff to operate these trains. In fact, most of the trains in the state of California already have 2-man crews. And we all know that there's tremendous advances in technology. We actually have cars that drive by themselves today that don't get into accidents because it eliminates human error. I believe that having 2 people being mandated could create distractions, which could further make the tracks more dangerous. And certainly there's an incompatibility. What happens when these trains with mandated 2-man crews go into other states that don't require the same? We're going to have people getting on, people getting off trains. I say leave these decisions up to the operators of the trains that obviously want to protect their investment, not only in their own infrastructure, but in the infrastructure and the products and goods that they're carrying from the ports. And so this is, again, I think, another example of the state intervening in an issue where really we should let the private sector that runs these trains have the opportunity to govern their businesses without government interference. So I respectfully ask for a no vote.
Thank you. Additional debate or discussion on this item, members? Seeing none, would our senator from the bicycle capital like to close?
There's nothing wrong with positive train control. That's a good thing. However, it's years away, and frankly, it would not prevent, according to our research, a rear-end collision, for example, with 2 trains within the same block or consecutive signals, and wouldn't protect against a train which entered the main line without authority from another track uncontrolled or adjacent track or yard track. So I would ask for your aye vote. This is for safety, and we need to do as much as we can at the state level to push this forward. I ask for your aye vote.
Thank you. Secretary, please call the roll.
Allen? Anderson? No. Bates? No. Bell? Aye. Berryhill? No. Block? Aye. Canella? Aye. De Leon? Aye. Fuller? Gaines? No. Galgiani? Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Hueso? Aye. Huff? No. Jackson? Lada? Aye. Leno? Aye. Leva? Aye. Liu? McGuire? Aye. Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? No. Morrell? No. Nguyen. No. Nielsen. Pan. I. Pavley. I. Roth. I. Runner. No. Stone. No. Vidak. No. Wachowski. I. Wolk. Wolk, aye.
Please call the absent members.
Allen. Fuller. Galgioni. Jackson. I. Liu. Nielsen.
Ayes 23, noes 11, the measure passes. Moving to file item 44, Senator De Leon. Pass on file. File item 45, Senator Hernandez. Pass on file. File item 46, Senator Hill. Secretary, please read.
Senate Bill 34 by Senator Hill and Act relating to personal information.
Senator Hill.
Thank you, Mr. President. Members, SB 34 establishes reasonable privacy and transparency requirements for the use of automatic license plate readers. This is important because current law has not kept up with the rapid adoption of the technology by law enforcement agencies and private businesses. SB 34 simply requires local governments to allow for public comment when they consider acquiring license plate readers. The bill also requires entities that use license plate readers to adopt a privacy and use policy, to keep a record of when data is accessed, and to protect the data with reasonable security safeguards. The bill takes sensible steps to protect civil liberties and privacy, while still balancing law enforcement's ability to use the technology to catch criminals. SB 34 has no opposition and is supported by the California Civil Liberties Council and numerous others. I respectfully ask for your aye vote, members.
Thank you, members. Debate or discussion on this item? Debate or discussion? Seeing and hearing none, Secretary, please call the roll.
Allen. Anderson. No. Bates. No. Bell. I. Berryhill. No. Block. I. Canella. I. De Leon. I. Fuller. Gaines. Galgioni. I. Hall. I. Hancock. I. Hernandez. I. Hertzberg. I. Hill. I. Hueso. I. Huff. No. Jackson. Lada. I. Leno. I. Leyva. I. Liu. McGuire. I. Mendoza. I. Mitchell. I. Monning. I. Morlock. No. Morrell. No. Nguyen. No. Nielsen. No. Pan. I. Pavley. I. Roth. I. Runner. No. Stone. No. Vidak. No. Wachowski. I. Wolk.
Secretary, please call the absent members.
Gaines, no. Allen. I. Fuller. Jackson. I. Liu. Wolk. Aye.
Ayes 25, noes 12, the measure passes. Moving to file item 47, Senator Hancock. Pass on file. File item 48, Senator Hertzberg. Secretary, please read.
Senate Bill 272 by Senator Hertzberg, an act relating to public records.
Senator Hertzberg.
Thank you, Mr. President. Last legislative session, Senator Leno and Senator Steinberg passed as part of the budget a measure dealing with the requirement of local governments to respond to Freedom of Information Act requests and to put up websites. That found itself in Proposition 42 on the June ballot, passed by the people. It gives authority, and what basically it did was it said that these now are constitutionally required and the state does not have to reimburse. And as we move forward in this whole new open data and data technology, the question is, what do we do? The measure says that the state has the ability to pass legislation and regulations relating thereto. This is the first step after a lot of consideration of what to do. And basically what it says is to local governments, you got to start giving us your enterprise systems that Senator Wachowski is so keenly aware of. And you basically got to start inventorying it as a first step to then gather data in this whole new effort to capture data. And we're taking a conservative approach. This is limited to local jurisdictions, and it's really a first step to then have us, as this body, to then look at the next level and the next level to make sure that as we move into this area of open data, we do it responsibly, intelligently, and thoughtfully. I ask for your support of this measure. Thank you.
Members, debate or discussion on this item? Debate or discussion? Senator Nguyen.
Mr. President, if I am correct, I think this is Senator Hertzberg's first bill.
Not in life, but in this body, yes.
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 And
Would you
my
like to ask-
question,
With that, Senator
Senator,
Hertzberg, would you take
may
a
I
question?
would you take a question?
Can I think about it? Yes, of course, I'll take a question.
Thank you.
Go have at it.
I'm just curious, since this is affecting local government and all the thousands of local elected officials, have they all been invited and been put up on as a tequila bottle on your wall?
I refuse to answer on the grounds that may incriminate somebody. Thank you, though. I'll give it due consideration, Senator.
Thank you.
Members, additional debate or discussion on this item?
Actually, I'm sorry, Mr. President, just one thing.
Senator Nguyen.
I do not want this to go as a unanimous vote. I think you have the right to have each of us say yes or no on the vote. Or
Thank you.
no.
Members,
I didn't say yes, I just said yes or no.
I think it's
Debate or
passed
discussion?
unanimously of all
Senator
committees.
Allen.
Senator, is this your first bill on the floor?
I answered that question, yes.
Well, I'm
On
asking
this
you a
floor
second
at this
time.
time in history, yes.
Yeah. Could you please give us a sense of the jurisprudential history of the Brown Act as it relates to this bill?
Well, this exempts us. The history of the Brown Act applies to locals, Senator. This basically is a result of Senator Leno's good work and Senator Steinberg's work, amends the Constitution of the state of California and says it's a constitutional obligation of all local governments to provide this information. And that's a good thing.
All right, and would you, in the spirit of transparency,
Through
would
the
you be,
presiding officer, please, Senator Allen.
in the spirit of transparency, would the presiding officer please ask the senator to provide the Senate with records as to the purchase of his new pair of glasses? I'd like to know where he got those.
Senator Hertzberg, would you like to answer that question?
Is that just for these glasses or a bunch of glasses I bought all at the same time? I just want to clarify that question, Senator.
Mr. Chair, I think the senator is obfuscating and needs to really think about his commitment to transparency.
Thank you, members. Additional debate or discussion on this item? Hearing seeing none, Secretary, please call the roll.
Allen. I. Anderson. I. Bates. I. Bell. I. Berryhill. I. Block. I. Canella. I. De Leon. I. Fuller. Gaines. I. Galgioni. I. Hall. No. Hancock. I. Hernandez. I. Hertzberg. I. Hill. I. Hueso. I. Huff. I. Jackson. I. Lara. I. Leno. I. Leva. No. Liu. McGuire. I. Mendoza. I. Mitchell. I. Monning. I. Morlock. I. Morrell. I. Wynn. I. Nielsen. I. Pan. I. Pavley. No. Roth. I. Runner. I. Stone. No. Vidak. I. Wachowski. I. Wolk. Wolk, aye.
Call the absent members.
Pavley. Okay. Okay. Stone, no to I. Pavley, no to I. Leva, no to I. Hall, no to I. And Fuller, Liu.
Ayes 37, no 0. The measure passes. File item 49, Senator Hernandez. Secretary, please read.
Senate Bill 323 by Senator Hernandez and acroling to healing arts.
Senator Hernandez.
Thank you, Mr. President and members. The Affordable Care Act just placed 4 million new individuals in our healthcare system that, as we know, was already struggling to meet California's needs. As you all know, we face a shortage of physicians here in California, with just 16 out of the 58 counties have the recommended ratio of physicians to residents. Additionally, 1 in 3 residents receive care from Medi-Cal system where wait time to see doctors can take as long as 9 months. We can no longer afford to get by the fraction of professional capacity. California needs more healthcare providers practicing to the full extent of their education and training so we can all have access to them efficiently. This bill does three things. It establishes a uniform scope of practice for nurse practitioners that everyone agrees on is how they practice today. It requires a nurse practitioner to refer a patient to a physician or another licensed healthcare provider if a situation or condition presents that is beyond his or her education or training. It grants nurse practitioners the ability to practice outside a physician-directed standardized procedure if the practitioner has certified by a national certifying body, maintains professional liability insurance, and is practicing in a clinic, a health facility or county medical facility, an accountable care organization, or a group practice. Nurse practitioners provide safe and effective patient-centered care. We have 30 years of evidence in 20 states that already allow full authority that all say the same thing. When individuals are treated by nurse practitioners, patient outcomes are equal to their physician counterparts, and patient satisfaction is generally better. There is no disputing this fact. Additionally, healthcare is transitioning to a team-based approach in managed care. This bill will do nothing to change that. We have crafted this bill to ensure that nurse practitioners with full practice authority are practicing only in team-based settings, which is one of the reasons why CAPG, who is our leaders in advancing coordinated care in our healthcare systems, are strong supporters of the bill. They would never support something that moves healthcare towards fragmentation. Today, as we kick off National Nurses Week, please join me with Assemblymember Eggman, hospitals, clinics, health plans, physician groups, large and small businesses, labor, consumers, academics, universities, seniors, and a broad array of healthcare providers in support of the full practice authority of nurse practitioners. More than 18,000 of them are here in California and stand ready to help meet our healthcare needs. And with that, members, I respectfully ask for an aye vote.
Members, the better discussion on this item. I was being facetious. Senator Nielsen.
Mr. President, ladies and gentlemen of the Senate, I respectfully rise in opposition. Ironically, the day before this bill was before the Health Committee, I was seen by a nurse practitioner, a wound in my hand on the ranch where I was being careless, cut it pretty deeply. Magnificent job. Nurse practitioners are superb. And I think that they have their rightful place. And I think that this bill, with some modification, would be worthy of support. Right now, I can't. It undermines a teamwork basis of healthcare where different individuals, such as nurse practitioners, work as a team under the supervision of a physician. There is no question that this expands scope, including giving them some authority to determine unemployment qualification. That gives me a little bit of concern in itself. I think what we need to do, though, is to ensure that there are parameters under which they have got to work. This expands the latitude for that independent decision of a nurse practitioner. Frankly, I have a hard enough time dealing with doctors now. I think that under HMO medicine, we've greatly driven a wedge between the doctor-patient relationship and, in fact, the nurse-patient relationship. And I think the ACA absolutely is doing that, a wedge between the patient, the doctor, and even the nurse. But here is another possible creeping wedge between that relationship of a patient with a doctor. It is inarguable that they have superior training to nurse practitioners. Doctors don't need to do everything, but I do think they need to set the parameters. If those kinds of amendments come into this bill, I will be arguing in support. But short of that, I cannot support it today.
Senator Bates.
Thank you, Mr. President and members. I, too, must rise in opposition of this bill today. From personal experience, I still remain concerned about allowing our nurse practitioners to prescribe drugs and now independent of physician supervision. For patient safety, I believe there needs to be adequate oversight of the profession to ensure the standards of care that we all expect. And I am concerned that the nursing board at this point in time is not the right entity to provide that oversight, specifically because with approval of this legislation, nurse practitioners will now practice independently and essentially in the role of a primary care physician. For that reason, I would like to see the medical board as the oversight for this profession as it moves into giving greater care in a doctor's office. At this time, regrettably, I must ask for a no vote on SB 323, and I do applaud the author for all of the amendments he has considered as it's worked its way through the process.
Thank you. Senator Stone.
Thank you, Mr. President. As one of 4 healthcare professionals in the legislature, I rise in support of SB 323, and I have extensive experience with nurse practitioners in the 6 pharmacies that I've owned and operated in the past 34 years. And I can tell you they're highly professional. There is a requirement today under existing law that they work under the direction, auspices of a physician. I have seen in my practice that this is more of a financial relationship rather than an oversight relationship. But I do want to thank the Senator for bringing this important measure forward. As everyone knows in this chamber, access to health care is critical. In the state of California, and SB 323 will make sure that people have access to health care in our state. The Affordable Health Care Act and Covered California have provided medical coverage to millions of Californians, but what good does it really do if people can't get in to see a primary care physician? And we have a primary care physician shortage in the state of California. The reality is that people need more medical professionals to rely on to give them the treatment they require, especially in rural areas. My county is one of the largest in the state, geographically. I've got a lot of rural areas that don't have primary care physicians that are perfect for nurse practitioners to practice in. SB 323 is attempting to accomplish that by allowing nurse practitioners to provide services to for people who just can't get to see a physician. As a pharmacist, again, I've had the privilege of not only working with nurse practitioners, but as an assistant professor of pharmacology at Cal State Dominguez Hills, I taught graduate nursing students pharmacology. I taught graduate nursing students how to prescribe medicine. And I can tell you that they are very proficient after they take my class. Nurse practitioners are highly educated, having a master's degree, in many cases having a PhD. They are more qualified to handle many of the cases who need the basic medical services, many of the same responsibilities we give to physician assistants that don't have anywhere near the same education as nurse practitioners. Some of the opponents of this legislation have said that expanding the scope of practice for nurse practitioners could harm patients, but I'm telling you that is simply not the case. This bill will not allow a nurse practitioner to just open up a shop in our respective cities or counties and just start providing medical treatment as independent practitioners. This bill will require nurse practitioners to practice in a medical facility. My friends, with more than 1/3 of our population now on Medi-Cal, and very few physicians take Medi-Cal, 1 out of every 2 children are on Medi-Cal, we have a responsibility as a legislature to improve access to health care for this underserved population, and with the hopes that registered nurse practitioners will take the Medi-Cal that physician groups won't take. Until more physicians start taking Medi-Cal patients, we need to find ways for people to receive proper medical care, and this is certainly that modality. I'm sure many of you heard from consultants that they just can't get in to see a doctor. You get sick, you want to get in there tomorrow, I'm sorry, it's going to be 4 weeks before we can get in to see you. God forbid you should have a horrible medical condition where you don't make it to the doctor within 4 weeks because you expire because you didn't get that diagnosis that was desperately needed. If SB 323 is passed and signed into law, our constituents will have the ability to see a qualified medical professional when they need care that was promised by the Affordable Health Care Act. To my colleagues here today, I just want to say that SB 323 is good common sense legislation. It improves access to care. It will keep people seeking regular medical attention out of our emergency rooms, which is a problem for all of us in all of our districts, as we see people using our emergency rooms for primary care visits and not for emergency room visits, which is very costly. And certainly, it will not jeopardize public safety. Whether or not you agree with the Affordable Health Care Act, we have to remember that it is, in fact, the law of the land. People need medical care, and this legislation will go a long way towards making sure that we can provide care to our constituents. I urge you to vote yes on SB 323. Please join me, nurse practitioners, and AARP's 2.3 million members that we rarely see coming out and supporting or opposing bills, but they are strongly in support of this one. Again, I want to thank the author for his hard work on this measure and urge an aye vote on SB 323.
Thank you. Senator Pan.
Thank you, Mr. President, members. I regretfully have to urge a no vote on this bill. As a physician and a primary care physician, I've worked very closely with many nurse practitioners. They're an extremely important part of the team. I agree with the author. They are proficient in what they have to do. And we work closely together in a team because there are times and situations where we need to support each other. There are things that they're very good at, there's things that physicians are very good at, and we really do need to think about that team approach. And certainly, one of the concerns, actually several concerns, but one of the concerns I have was brought up by a previous speaker is that as we are looking at nurse practitioners doing more diagnosis and treatment, especially if they're not being supervised, they should be overseen by the medical board, because the nursing board's not set up for diagnosis and treatment oversight. That is, that if you're going to start moving nurse practitioners into functions that are closer to that relating to the core functions of physicians, which is diagnosis and treatment, then you need to have oversight and consistent oversight. We don't want to have this divided across boards. Well, I certainly appreciate the author's efforts in terms of trying to narrow this to groups and so forth. Unfortunately, it's not narrow enough. For example, in the bill includes independent practice associations, which essentially are not integrated systems. Those associations are, they do joint billing, they do joint contracting, but that's not an arrangement that is. So in terms of having them work in an integrated manner, those are not structures that are designed necessarily for that. And in fact, I am concerned about fragmentation of care. I'm very supportive of team-based approaches. And we do need team-based approaches, and that's what I do in my practice. I practice in the clinic right now. I practice at university. But this bill has the problem of potentially fragmenting care more. And I'm very concerned about that, because that does lead to poor quality and more miscommunications. I know that one of the arguments for why this bill is necessary is workforce, right? We've heard about the expansion in Medi-Cal. Although I would note, when we look at our expansion in Medi-Cal, I think repeatedly we've seen the issue is actually payment. And in fact, the nurse practitioners will have face the same struggles the physicians do. And in fact, and even to the degree that we know in Medi-Cal, there are even situations where there are physicians willing to see patients, particularly in underserved areas, but the Medi-Cal plans aren't contracting with them, particularly minority physicians. I've talked to many physicians from minority physicians who say they want to see Medi-Cal patients, but the Medi-Cal plan doesn't want to contract with them. They're serving underserved areas. Black physicians, API physicians, so forth. And so I think that it's false to say that, well, we're going to now increase access simply because, to Medi-Cal, simply because we're now giving nurse practitioners more independent authority. I don't think that dynamic will change. Also, most nurse practitioners right now are actually, they're pretty busy, right? They're not sitting around having nothing to do and saying, I need independent authority in order to do work. They are working very closely with physicians, not just primary care physicians, but specialty physicians as well. Many nurse practitioners actually work with specialty teams and they have their very important place there. So I would also argue that just because we changed the scope, that we're not necessarily going to have a large increase in access. In fact, on the nursing side, there's been concerns about a nursing shortage. Now, realizing that nurse practitioners and RNs have different roles, but I think that we need to be concerned about that. So certainly, I appreciate what the author is trying to do, but I am concerned, first of all, is that basically we're not really solving the core problem, but also we're creating a situation where I think the oversight is not what it should be. And for that reason, I unfortunately am not able to support the bill at this time. Thank you.
Senator Hill.
Thank you, Mr. President. Members, I rise in support of SB 323. As chair of your Business Professions and Economic Development Committee, we had a very lengthy, robust, fact-driven and debate about this bill and in the policy committee. And the conclusions that I came to, and certainly the bill passed with 0 no votes, was that nurse practitioners are fully educated and certainly capable to provide primary care. In fact, one of the statistics, one of the facts that came out in the hearing was that the Institute of Medicine supports this legislation. It published a report in 2011 in which it concluded nurse practitioners deliver the same quality of primary care as physicians. That was the conclusion that they came to, and it was the conclusion that the Committee on Business Professions and Economic Development came to as well. So in order to provide our constituents with greater access to primary care, this bill is bringing us that much closer to that goal. So I ask my colleagues to support the legislation as well.
Thank you. Senator Berryhill.
Thank you, Mr. President. Question of the author?
Senator Hernandez, would you like to take a question?
Yes.
Without objection.
Yeah, I'm on that committee, and it was a robust discussion that we had the other day, a very good one. As in so many of these cases of scope, they're complicated and they're works in progress. And this you've come a long way, and I applaud you for that. You've worked very hard on this bill. With the healthcare system that we now have in California, this scope is going to increase, but I think we have to be careful about making sure that we cover everything, before we move this stuff forward, because I think there is unintended consequences. Are you continuing to work with CMA? They're not quite there yet. I understand that it's very hard to get them all the way there, but that being said, as this thing goes over to the Assembly side, are you going to continue working with CMA to see if we can't tweak? I don't think this thing is fully cooked yet. It's very close to being supportable. I just don't think it's quite there yet at this point in time. So are you continuing to work with CMA as we move this to the Assembly side?
Well, let me give you a history. As you know, most of you here already voted for this 2 years ago. It was a package of a variety of bills to address the issue. It made through all the policy committees, was held in appropriations on the Assembly side, and at that point, bringing it back now, and we re-amended it to address some, if not all, of the concerns. In the hearing, they said that they had some amendments they were going to bring to us. And keep in mind that when this bill was put to print, we sent it to the California Medical Association immediately. Full disclosure, bill in print, didn't change it or anything. And we got amendments yesterday in the afternoon that I've yet to see. I'm always committed to working with anybody, but right now, I'm not going to write law on the floor as we wouldn't on committee. But keep in mind that this bill in print, they've seen it for over 4 months and over 3 years. And to get the amendments late last night, yes, I'm more than willing to look at it, but I can't make a decision without even reading them yet. But I will look at them, and perhaps anything I feel is appropriate, we'll address them.
Okay, thank you. On my own time, Mr. President.
Without objection.
I'm like Dr. Pan, I kind of concur. I'm just a little bit uncomfortable with this bill yet. I think that it's very close. Nurse practitioners do a wonderful job. They're highly professional, and I get all that, and it's coming. But again, some of the unintended consequences that I think are still out there, I'm not prepared to support this bill today. I will be laying off. I encourage everybody to lay off until we get this thing right. And hopefully, when it comes back for concurrence, some of these changes, take a look at some of those amendments that they're asking for, and maybe I hope I can support this the next time around.
Thank you.
Thank you. Senator Gaines.
Thank you, Mr. President. Members, through the president, I'd like to ask a question.
Senator
Of the
Hernandez,
author?
would you take a question for
Yes.
Senator Gaines? Without objection.
Thank you. I'd just like to get some clarification because I really support what you're doing. I think there's a real need that needs to be addressed, especially with the implementation of the Affordable Care Act. But I have concerns regarding the ability of a nurse practitioner to certify disability for purposes of unemployment after performance of a physical exam. And another issue has to do with the managed and physical and psychological health status of patients, especially the psychosocial. I'm concerned about whether they have the appropriate level of expertise to make that decision. Would you be willing to work on those areas, work with the CMA on their concerns if this bill moves forward?
Well, I haven't, like I said, I haven't read their concerns, so of course I'd be willing to listen to them. But to address those two concerns that you have, this bill is going to allow nurse practitioners to do what they're already allowed to do through a standards of protocol. It's not going to change or do anything different. With regard to the mental health ability, they currently do that. Now keep in mind that one of the 10 essential health benefits that we've passed into law is mental health parity. We're going to have a really hard time with mental health parity. You have psychiatrists that aren't even taking insurance anymore because they're only doing cash-paying patients. We're going to have a huge distribution and a disparity problem, especially with mental health providers. So they are currently used right now. This is an area of great need, but I'd be more than happy to look at it. But like I said, I haven't seen any of the amendments yet.
Well, I'd like to, if we could have further conversations and
by all
obviously
means.
with the CMA, if this moves forward, and then certainly that certification of disability. It's a real concern I have, and I'm sharing it because it comes from my brother who's a medical doctor, and he says, you wouldn't believe how many requests come in for disability that these people are, in some cases, able-bodied.
Right.
And so he says, no, I'm not going to give you disability if you don't have an issue. And I just want to make sure that that is maintained. If you're giving that authority now to a nurse practitioner, I have a question mark.
And all providers have that same authority, just like many people come to me for disabilities for vision, and I say no a lot of times as well. And it's our responsibility as providers, and we're held to the same standards as everyone else.
Wonderful. Thank you.
Thank you, Senator Gaines. Senator Allen.
I just want to rise in support of the measure. I think that the senator from Temecula really articulated a lot of the really strong reasons for supporting this with regards to access and affordability. I would just, ask the author to, continue working with some of the folks who have concerns about this with regards to supervision and making sure that we always ensure the highest quality of care for people. So I'm going to support this measure today.
Thank you. Additional debate or discussion on this item, members? Seeing and hearing none, Senator Hernandez, would you like to close?
Mr. President, members, I want to thank you for the robust debate. And keep in mind that I started to do a body of work about 8 years ago when I was had a select committee in workforce. Pre-Affordable Care Act, we found out that we have a distribution problem. We have fewer and fewer physicians going into primary care, more going into specialty care, but most importantly, even fewer individuals that are going to rural and inner city. Is this to solve the entire problem? No, this is just one part of it. Here's what we need to do to solve the entire problem. Yes, I agree with Senator Pan. We need to increase rates. I mean, obviously, I'm carrying that bill to do so. Yes, we need to increase and get more medical schools. Unfortunately, that's going to cost. Yes, we need to have more residency programs. I'm working with Senator Roth on trying to do residency programs in rural and inner city communities. Yes, we need to look at all providers to raise their level of skill, which they are trained to. And when I look at all providers, there's three things I look for. Number one, is there a national certification, and is it done at other states? Number two, Is it safe and effective shown in those other states? And number three, is there a prospective board in the state of California that oversees that profession, but most importantly, that protects the consumer? And yes, that's the case. So let me tell you about nurse practitioner who was mentioned. They are advanced practicing providers with a minimum of a master's degree and most a doctorate degree. There are decades of evidence showing that they are safe and effective in other states. Other states right now are increasing their scopes to address the workforce shortage. And with regard to collaborative care, all providers, whether it's a physician, a dentist, an optometrist, a nurse practitioner, we all practice to the standards and we all refer when we know we're unable to provide that care. But most importantly, we're all held to the same standards as everyone else. Therefore, they're going to get sued, and you have that board that's going to oversee those particular providers. So members, with that, I respectfully ask for an aye vote.
Secretary, please call the roll.
Allen. Aye. Anderson. Bates. No. Bell. Aye. Berryhill. Block. Aye. Canella. De Leon. Fuller. Gaines. Galgioni. Aye. Hall. Aye. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Aye. Weso. Aye. Huff. Aye. Jackson. Lada.
Aye.
Aye. Leno. Aye. Leyva. Aye. Liu. McGuire. Aye. Mendoza. Aye. Mitchell. Aye. Monning. Morlock. Aye. Morrell. Wynn. Nilsson. Pan. No. Pavley. Aye. Roth. Aye. Runner. Stone. Aye. Vidak. Wachowski. Aye. Wolk. Wolk, aye.
Call the absent members.
Anderson. No. Berryhill. Canella. De Leon. Aye. Fuller. Gaines. Aye. Jackson. Liu. Monning. Morrell. No. Wynn. Nilsson. Runner. Vidak. No.
Ayes 25, noes 5. The measure passes.